you have any questions about health supplements and stuff like that, or you just want to come say hi to our special guest here, we're on Facebook Live at TRAXXfm Official. So earlier on, I did mention that we are going to be talking about health supplements, the safe use of supplements, and none other than the expert who's going to talk about it today, Mr. Munaver Ahmad. He's a consultant pharmacist. Good morning to you. How's everything?
Yes. Great day.
Yeah, great day. Happy new month to you. It's the 1st of July.
Thank you. Same to you.
Yeah, so welcome to the studio of TRAXXfm. And today we're going to be talking a lot about supplements and stuff like that, right? So even just now, as I was on my Instagram, I already saw a couple of ads like, oh, try this supplement today, try that supplement today. So can you clarify, what does health supplements mean? What exactly is health supplement?
Okay, I think a health supplement refers to any products that supplement a diet. I think that is the first thing that we got to know.
Yeah.
And of course, it's also used to maintain, enhance, or improve the health functions of a body.
Yeah,
right?
okay.
So let me elaborate more. Because it is presented and administered either in tablets, capsules, in powders or liquids. However, this is there's a caveat here. It is not categorized. Health supplements are not categorized for injectables and sterile preparations such as eye drops. Okay, and if we expand further, it may contain either one of these substances such as vitamins, minerals, amino acids, fatty acids, enzymes, and probiotics. We also have health supplements that are extracted from natural substances,
Right.
From the minerals and from the plant herbs extracts.
Yeah.
And finally, on the synthetic, let's say, supplements, we have plenty of that in the market currently. But however, the safety profile of the synthetic supplements must be verified. So I think health supplements has been used over decades.
Yeah.
You have traditional Chinese and Malay medicines.
Yeah.
You have the prophetic medicines. You have even Ayurvedics. Right? So I think that is the scope of the health supplements that we're talking about today.
Right. So do you consider those herbal medicine health supplements?
Yes, it comes under that group. As long it comes under this categorization. That means, however, herbal supplements must be registered with the National Pharmaceutical Regulatory Agency.
Okay.
For the profiling of the quality and the safety of the products. So I think a word of caution to all of us out there: please make sure that the supplements that you take are registered from MPRA. You can go to the website, which is called Quest3, QUEST 3+, to verify the supplements.
Right. Okay. So just now you did mention something interesting, because I always thought health supplements only come in the tablet, the big ones. That's why in my 18 years, okay, I'm not 18, but okay, in my whole life, right, I don't dare to take health supplements because it's like so big, and then it looks weird. Sometimes the color got like coloring and stuff like that. So you mentioned just now it comes in powder form. So do you think like protein shake is not, right? It's not health supplement.
Okay, protein shake comes in a different context under health supplement. It's for the purpose of wellness.
Yeah.
And let's say sports purposes,
Correct, yeah.
It's still considered as a health supplement.
Really?
Yeah, it's basically the mode of let's say administration that is important, right?
Yeah,
and the let's say, for example, now we have a powder form. We also have health supplements that is in sachet.
Yeah, correct.
Liquids and all, right?
Yes.
So it is categorized under health supplements.
Oh, all right. So in recent years, which one do you find like people gravitate more towards? Like powder form or still the traditional tablet form?
I think that is the needs of the supplements is based on the individual needs.
Right.
So for children, right, they will go for gummies.
Oh, right?
Especially for those supplements to increase appetite, right? But when you talk about adults, they prefer to pop the pill.
Right.
Let's say for hectic working adults like yourself, you'll be going for effervescent type. Pop into the water, let it, let's say, burst, and then just
drink it.
So it depends actually on the lifestyle, the age group, and also the needs of the individual, actually.
I see. That's very interesting. So there we go. Protein shake, if you have it, it's actually a health supplement, man. Okay. Moving on, what is the difference between health supplements and drugs?
Okay, this is a very, for me, it's a very, very important issue because we need to understand that drugs have gone through extensive clinical trials and developments.
Right.
And you know that the pharma has spent billions on developing drugs. Okay. So they have gone. We have the clinical stages: stage 1, 2, 3, and 4.
Right.
Right. So 3 means that it's tested on humans in large populations.
Okay.
And 4th is basically the time needed, the years needed for the pharma to report to the authorities on adverse drug reactions after a couple of years.
Okay.
So this is where the drugs have gone through these stages.
Okay.
However, this is a term which is called in vivo,
Alright,
INVIVO, in vivo. But however, supplements have not gone through that stage. It's more basically focused on laboratory conditions,
Right.
focusing tested on labs, lab rats, for example, in animals and mammals, and also on let's say a small scale. So we call this term as in vitro.
I see.
Okay. But the good thing about the research now, we have seen an expansion of research focusing on herbal supplements. You know, the recent study was on the antiviral properties.
Right.
That was before COVID-19. There was a large-scale studies on humans on antiviral properties of garlic, ginger.
Yeah, correct.
Yeah,
Yes,
if you remember.
yes.
We also have studies on colostrum. I think this is something very important. Colostrum is the first milk of the cow.
Oh.
The yellowish gold, liquid.
Correct,
and colostrum is also the first milk of a mother.
I see.
That is that government advocates, especially when you go to the nurses, the government advocates the mothers to feed the baby with that. So colostrum has also been researched very well on humans.
I see. All right, so that's basically the main difference, like the duration of how long they study the thing lah. Okay. Before we move on to the next question, I actually do want to ask this one. Let's say this is my personal question. Okay. Let's say because I suffer from migraine every month, right? And I take paracetamol, obviously, because I want it to, hurry up and go away. Yeah, so I don't want to do that. And I know a lot of my friends, because when we have busy schedules and we're young and whatever, we tend to suffer from migraine, you see, sleeping schedules, stuff like that.
Yeah.
So is there some kind of supplements that can help with that?
Okay, I think to understand the problem is more important. First of all, what is the cause of migraine? I was also a migraine patient.
Okay, yes, please share.
So the thing is that what we need to do is go on let's say non-pharmacological approach.
Okay.
When you say non-pharmaco, it involves lifestyle modification.
Okay.
Educate rest, plenty of water, and basically migraine has its symptoms prior to the blast of the migraine attack, right?
Yeah.
So you will know you have an aura, you will have certain, let's say, conditions that will predict you to have the migraine.
Yeah.
Right. So what I normally do is that I do myself, and also I want my patients to quickly take rest, go to a dark room. It's very, very simple. Get some fresh, let's say, cool air towards you.
Yeah, correct.
Get a wet towel to, let's say, close your eyes and rest. Even if you don't sleep, it's okay. But migraine at the moment, we can say that you can also, the other one is to reduce excessive caffeine.
So
I think now our country is going towards coffee and caffeine, you know. So that's the second approach. But at the moment, you can also take milk. Milk is basically a very relaxing, let's say, food supplement, for example, a natural food. And worst case scenario, you still have to be on anti-migraine, let's say, medications.
Yeah,
you know,
correct.
Headache, the basic for paracetamol, you have naproxen. But I will definitely not advise anyone who was a migraine patient to go on long-term medications without doctor's advice.
Correct. Because sometimes I do try to do the natural remedy, right? Like how to say, go into a dark room, close all the curtains, blast my aircon, and then as I close my eyes, it's throbbing, you know, like my eyes is about to pop out kind of thing.
Yes.
So, and then at the end, I have to resort to paracetamol, you see. So, I don't know. I think I actually encountered a pharmacist once, and he said to take magnesium.
Yeah.
Does that help?
in a way, yes. It helps to relax. But there are also herbs like valerian.
Okay.
You have even lavender. You can use aromatherapy as well.
Really?
That will
Wow.
basically ease
Okay.
actually
Okay.
the symptoms of migraine. And magnesium has many wonders. It's a calming, I will say, a mineral. Which has a calming effect not only on the blood system but also on the muscles. So have you started taking magnesium?
No, that's why I don't know which good ones and stuff like. And I'm scared. You see, you know what I'm saying?
Yes.
A lot of people, millennial, they're quite scared. They want to, because I want to take supplements, but I don't know which ones. And listening to some of my friends who are also like pharmacists, and like, oh, this one got side effect. This one, okay, stop. I'm not gonna do it. So I might as well just rely on like natural stuff. But that clarify something. So to those of you tuning in right now, because I know a lot of people who are tuning in, they suffer from migraine. It's a lot of it, like yourself as well. You used to have migraine, right? So try the natural remedy, and if that doesn't work, then you have to take those kind of things. Like I could be drinking lavender, also cannot help, right?
No.
Right.
When it comes to the stage that where you need to be treated, of course you need to take medication.
Yeah, correct. Okay. Moving on, in the grand scheme of human health and wellness, what is the purpose of health supplements?
Okay, I think firstly we have to understand that supplements are not here to replace any our diet. Okay. But again, you see, migraine is one of the symptoms of stress.
Yes.
Right.
Yes.
So this is actually our lifestyle. Back from the 1980s has not been a good one. We live in a very, let's say, hectic environment. And we also do not take proper foods. We are on fast foods. There's and of course these two factors will trigger stresses in our body.
Correct.
Okay. So on these reasons, right? I mean, first of all, the purpose of supplements is basically to, as the word says, to supplement the unbalanced, let's say, nutrients, the deficiencies of nutrients, vitamins and minerals in our body. That's the first stage. And second of all, what happens when our body is under stress? It basically creates free radicals. Okay, what is free radicals? Free radicals basically are molecules.
Okay.
We can say that these are scavengers. Okay, unstable molecules in our body that basically attacks other stable molecules. This is more on the chemistry part.
Correct.
And we have electrons and protons. So it will basically steal a electron from the molecules. And what happens? It will cause a chain of reactions that will lead to damages in our tissues, organs, and increase the risk of diseases. So the purpose of basically supplements is basically on the second part is to reduce free radicals in our body by putting in the antioxidants,
like the better stuff.
So you put in the defenders, to basically neutralize the free radicals. So we have plenty. Basically, you have vitamin C, vitamin E. You even have let's say functional foods like olive oil, broccoli, which is high in ORAC value, the antioxidant values.
Correct.
So this is basic. I will say this will be the basic stuff that you need to start the supplement.
Right. Yeah. Very interesting that you said that, because like when I was first introduced to supplements, I think it was like 2019, 2018. I didn't even know what supplement was. And then 2018, I think one of my friends, she said, "Hey, you want to try this supplement?" And then I said, no, thanks. Then she says, "It's fiber. It's a fiber supplement, right?" And then I said, "Oh, okay. Then I can just eat fruits, right? Or vegetables." And then she put this really very interesting picture in my head. So she said, "Can you eat 4 bananas straight up? Can you eat 2 watermelons straight up? Cannot, right? So this fiber inside this supplement, there's all this fiber in there." So I'm like, "Wow, 真的啊, wow, 这么好啊, like so good." So then, so is that how you would describe like a supplement pill? Like all of those, let's say 4 bananas, 2 watermelons, 3 dragon fruits, all in that one pill?
Okay, I think this is a typical marketing strategy to sell a product to you.
Okay, right. I see.
And fiber has been promoted heavily, not in pharmacies, but even online and among supplement dealers. For me it's simple, because what's the purpose of the fiber? You have 2 types of fiber, which is soluble and insoluble fibers. Right. Some of the fibers have prebiotics. I think we know about that. And prebiotics are the food for probiotics. So this fiber basically focuses on the gut system. Right. So for me is that as long as we can take rainbow of let's say a color of rainbows of vegetable and fruits.
Yeah.
For example, in one day maybe you just take 2 or 3, but taking 4 bananas, taking 3 oranges is I think that's overdosage of fruits, right? So the thing is that how do you see the function of fiber is basically more for the gut to relieve constipation, to have a healthy bowel system, for example. But as long as you have that, why should you go for the fiber? Unless again, what is the need of the supplement is to supplement what you do not have and to enhance or improve the function of that particular organ. So fibers, if needed, if let's say there's some digestive problems, you may need that.
Right.
But otherwise, maintain a healthy lifestyle, 8 glasses of water per day, brisk walk 30 minutes per day, that's good enough.
Yeah. All right. Very cool. Very interesting. So, if you have any questions on health supplements, we are on Facebook Live right now at TRAXXfm Official. Asked too many of my own questions, sorry. But we'll be taking a short break. We'll be coming back and we'll talk about some other interesting stuff about health supplements. So, once again, if you have any questions, you can drop them in the comments section. a.m. on the clock right now. It's Health on Traxx, the interview. And of course, we have Mr. Munaver here. He's a consultant pharmacist. We're talking about health supplements and the safe use of supplements, right? And how are you feeling today, right now?
Good.
Because I'm about to tell you, you have some interesting questions on Facebook.
Okay.
Yeah. Like I said, if you're tuning in right now and you have questions about health supplements, or you want to start your journey, of supplement journey and stuff like that, you can definitely ask your questions. We're on Facebook Live at TRAXXfm Official. And okay, before we start with the questions, now on Facebook Live, let's take a look-see. A lot of people are saying good morning to the guest. Yes. All right, let's take this one. Sean Adika. He says, always sleepy, 33 years old. I sleep 1 a.m. to 10 a.m., so that's 9 hours. Recently took Essential Forte, but seems not helping. So, all right.
Okay.
What do you have to say to that?
Sean, I think we need to do a larger scale of, let's say, investigation. But we need to identify what makes you sleepy every day. Okay, the type of work that you're doing, which is important. Occupation is very important.
Yeah, correct.
Right. And third, at 33-year-old, you should be having a normal sleeping life, a normal, let's say, rhythm of sleeping.
Yeah.
Right.
Which
is basically between 5 to 7 hours lah.
Wow.
So
Okay.
there's people say that you got to take up to 8 hours of
correct,
sleep a day.
correct.
But you remember the former Prime Minister of UK, Margaret Thatcher, she sleeps only 5 hours per day.
Right.
So
right.
this is very individual. But again, the second thing is sleeping too late, 1 a.m. Our normal nocturnal time is between, we should be in bed by 11 max.
Right.
Okay. The next thing that I would like to explore is the usage of mobile phones, and computers, because the rays from the phone basically is as strong as the rays from the sun. So when you use mobile phones late at night, basically it will dilate your eyes. Then when you go to a dark room, it takes very long for the people to basically constrict. So that's another one. Third will be, are you on any caffeine products? I will ask you again. Are you taking late supper, for example? That will affect the sleep, let's say, the sleep pattern.
Yeah.
Okay. Essentially, fourth basically is a tonic for the liver.
Oh.
So basically, I'm not sure why you're taking that. Unless basically your lifestyle is not balanced.
Yeah.
You want to protect the liver.
I see.
So it's basically, it has loads of B vitamins, and it also has a product which is called Silimarine.
Right.
But however, we need to basically investigate further on this. My advice is go back to a proper lifestyle, do proper exercise, plenty of water, try taking milk at night,
Right,
So
right.
it may help actually.
So Sean Adika, there we go. That's your answer. This one, Uven. I eat supplements until I fever. My migraine cause from smell. Sometimes heaty, sometimes less or oversleep. So I don't know what kind of supplements you're eating until you fever. Is there such thing?
Again, be careful with what you're taking, because supplements are not, I would say, normal foods like we take.
Yeah.
Again, I agree with you. So, what supplements are you taking that make you have developed fever?
Correct. Correct.
And then again, go back to a proper lifestyle. I always advocate. In Malay, it's called ARMSUS.
Wow. Okay.
Okay, but it's I'll just use a bit of Malay, then I will translate English.
Yeah.
You must have adequate water, air. You must have adequate rest, rehat. You must have the proper food, makanan M. Okay, you must have, let's say, enough of exercise.
Yeah.
Okay, moderate exercise, senaman.
Yeah.
If you're on medication, do not stop. Ubat. And finally comes the supplement. So my advice to you is that to seek proper advice from a pharmacist or nutritionist or even a dietitian to see what's really going on with you.
Right.
So I think that will be the advice at this moment.
Yeah. Diagnose first, right?
Diagnose first. Yeah. Get it done first.
Yeah, so to those of you tuning in right now, we are on Facebook Live at TRAXXfm Official. You can leave your comments there. Right now, it's back to my questions.
Okay.
All right, so since we're talking about the health side effects and stuff like that, is there evidence that health supplements are needed? Let's say, because I've never, ever, even my mom, right, until this day, she doesn't even, she said, hey, you take supplement? I said, no, I did not. So, okay, is there any evidence that health supplements are needed?
Okay, I think this is a very important question as well. We need to zoom to the needs of the individuals.
Okay.
I'll give you an example of calcium.
Okay.
Calcium is an important supplement that's already added in the regimen for pregnant mothers.
Right.
Okay, and also for osteoporosis. You don't mind me asking how old is your mom?
My mom, 55?
Okay.
Yeah.
Once you hit 50, you're going towards osteoporosis.
Like the
You
bones
know,
thing, right?
brittle bones
okay,
and all.
Okay.
So definitely you need to top up with calcium. Alright, because as you age, the risk of frailty and falls will become higher.
Correct.
Okay, so that is where evidence is there that you need to have this supplement.
Okay.
For pregnant mothers, basically you need calcium to prevent a condition which is called preeclampsia. Preeclampsia is basically hypertension during pregnancy, which is a danger to the mother and also the baby.
Okay.
And we know about folic acid, right?
Yeah.
So folic acid is one of the fastest moving supplement in the pharmacy, right? For women who are trying to get pregnant, and also for those who are early in pregnancy, because folic acid will basically reduce the detrimental risk of neural tube deficiencies among in babies.
Right.
The interesting fact about vitamin C, we are taking vitamin C daily.
Yeah, correct.
But do you know that smokers have depletion in vitamin C's? So for those who are smoking, they need to add vitamin C.
Right.
But of course, from the medical point of view, stop smoking.
It's
much better than bombarding yourself with vitamin C's.
Yeah.
And there's also a link that supplements are needed for obese patients. For those who are trying to reduce weight, right? Obesity patients will have deficiencies in nutrients such as vitamin A, vitamin D,
Correct.
iron, calcium, zinc. So we need to understand that evidence is there, and the needs of the health supplements are already proven.
Correct. So there we go. Moving on, this one. Like just now, I'm very, very sad that I have fallen into the marketing tactics of people. So the next question is going to be that marketing tactics everywhere, right? Like this morning alone, I've already seen 2 of the, suggested page or whatever. Yeah, so it popped out on my Instagram. Marketing tactics of the health and wellness industry, especially in the era of digital technology. And the many choices of supplements, because you have all types of different brands. Some even got into trouble for not getting the license or stuff like that. We've all seen that. So how can one choose a health supplement? What do you look for?
Okay, I think it goes back to the onus goes back to the individual, right? We ourselves must be ready to equip us with the right information from the right sources.
Right.
That's the first thing. Okay. Data from this 2019 National Health Mobility Survey.
Okay.
It has stated that up to 35% of adults in Malaysia do not have adequate health literacy. We are talking about financial literacies. We're talking about literacies, but
yeah, correct.
35% do not have it. Okay. If you see the data of 2022, 23 million are adults above 18 years old. So 35% of that is 8 million.
Wow. Yeah,
do not
correct.
have adequate health literacy. So the second more alarming issue is that the era of digital technology, it has led to infodemic. We've heard about pandemic, but we're talking about infodemic, misleading information, and false information that can be manipulated by sellers of, let's say, herbs.
Yeah.
We have a term which is called rogue pharmacies.
Rogue.
ROGUE.
Wow.
Okay.
Yeah.
We have to be careful with that. So for me, is that consult your healthcare professionals. Okay. Consult the pharmacists, nutritionists, dietitians, doctors, and also those who are in the healthcare industry certified by authorities.
Yeah.
Okay. So I think that is the first step that we need to do. So they will basically provide you the knowledge on how to choose a supplement.
Right. Okay, so that's like the number 1 step, right?
Yes.
So just now we did mention of like a lot of 35% are not educated in the health segment or stuff, right?
Yeah.
I think I can I can vouch for this, because some of my friends, right, when we talked about calcium just now, so I'll say, the calcium supplement, eat cheese lah. That kind of thing. What should I reply to that?
Okay, it again goes back to the, I will say the therapeutic dose needed.
Correct.
Or the recommended daily intake of that, let's say, substance that's needed. One calcium tablet will have 300 milligram of active calcium in it. how much cheese you have to take.
That's
to get the 300
correct,
milligram,
correct,
right?
exactly.
So I think we still have to see the needs of the individual actually.
Right, okay. Before we take a short break right now, what are the categories of people that need supplements? So just now you mentioned like people who are gonna have like osteoporosis, yeah, and like people who lack something their body, like maybe let's say if you don't eat vegetable, then you eat the fiber thing, right? Yeah. So what are the categories of people that need supplements?
Okay, we go on a larger scale. There's a term which I like to use is continuum care model. Okay, under this continuum of care model, you have 5 let's say sections: the preventive, promotive, curative, rehabilitative, and palliative care.
Okay.
So if you want to remain healthy, you will take supplements to maintain the health of your body, your function in the state of the body.
Right.
So this comes under the preventive and promotive care sector. But in case you suddenly you have a bout of flu or traveler's diarrhea, for example,
Okay.
it's a short-term acute illness. You want to recover. Okay, so this comes under the acute care.
Okay.
And you also need supplements to top up for let's say a short period of time.
Yeah, correct.
Besides antibiotics lah, all that lah. All right, it is prescribed by the doctors. We also have a group for chronic ailments, for like hypertension, obesity, let's say hypercholesterolemia. That supplements can be added for the management, right? And when you talk about rehabilitative, it's basically disabilities,
Right.
or they say post accident, for example. Fractures, for example, you may need vitamins and and supplements.
Yeah.
Okay. I will also categorize, let's say, people who need supplements under the wellness, let's say sports, for
Yeah,
example,
correct.
and also conditions such as joint pains, acne, for example. So it can be this. We basically say that again goes back to the individual needs.
Right. Okay. So basically, let's say if you have acne or like a lot of pimples and stuff like that, skin problems, supplements can help as well, right? Because
Yes.
yeah. All right. We'll be taking a short break, and if you have any questions right now, if you're tuning in, you can leave your questions on our Facebook Live at TRAXXfm Official. top of the hour, and I cannot believe 1 hour has just passed. But if you're just tuning in right now, we're also on Facebook Live at TRAXXfm Official. We're talking about the safe use of supplements. And just quickly, right, to those of you who want to start your supplement journey, your health supplement journey, so Mr. Munaver, what are the potential long-term causes of, sustained supplementation practices, like any side effects that you want to highlight?
Okay, I think firstly, as long as we take the recommended daily intakes, okay, we follow that regime, the RDIs, and we must ensure that it's taken according to the concept of 5R. What does it mean by 5R? 5R: right person, right supplement, right dose, right mode of administration, and right time. We need not worry about long-term side effects. But however, because again, in not only in Malaysia but in other countries, we are bombarded with vitamins and supplements. Right? So that's one issue. A cocktail of medications, supplements, we say. There's another vitamin that is quite serious if we taken in excess, which is called vitamin A. Vitamin A is taken for acne.
I see.
For skin. So if you take in excessive doses, there is, I think it's 25,000 IU per kg. For long term. You can develop a term which is called hypervitaminosis A that can lead to brain damage and death.
Wow.
So I think whatever it is, take within the RDI.
The
recommended daily intake.
Right. Okay, there we go. So that will be your side effect if you take too much. All right, final question for today. To those of you who are tuning in, or let's say you are a parent tuning in, right, and then you want maybe your child probably have some kind of deficiency in some area. So at what age, how young can one start to take supplements?
Okay.
Can 5-year-old take?
Yes, I think it's 2 years old and up. Okay.
Wow.
And again, depends on the condition. Some will see that there's malnutrition, or let's say children who do not eat well. Right. Fussy eaters for children. They can go on, let's say, probiotics, for example, which is good for kids. Okay. And up to adults, up to 80s or 90s, as long as they live a healthy life. So I think the minimum age, again, is around 2 years old.
Oh, wow. Okay, that's a new information for me today. All right, so once again, if you have any questions, you can always just drop them on our Facebook Live at TRAXXfm Official. I'm pretty sure Mr. Munaver will be very happy to answer them. But that is all for today's session. Thank you so much for sharing your insights. We have had Mr. Munaver Ahmad, a consultant pharmacist, to talk about the safe use of supplements. And if you have missed out on this interview, you can head on over to our Facebook at TRAXXfm Official to catch the full one.